It is important to have health insurance. Insurance companies or state-run insurance programs pay for some of the healthcare expenses that a person incurs. Sign-up is usually yearly and must be completed during a short period called open enrollment. If an individual works full-time, insurance is often offered by their employer, and in most cases, requires the individual to contribute money each pay period. This contribution can seem high, but in generally less expensive than paying for healthcare, and provide peace of mind in the event an individual falls ill or is injured. Some unemployed individuals qualify for state-sponsored health insurance. An enrollment is completed through an online healthcare marketplace. The applicant will require to provide documents to prove income or lack thereof. Health insurance helps pay for some or all medical expenses. Patients often pay for a portion of the bill. This is called a co-pay or co-insurance. Some people do not have access to health insurance and will not qualify for state-sponsored insurance. In this case, some hospitals offer free care programs which require an application process to be completed. There are many types of health insurance. What kind of coverage an individual decides to sign up for or purchase depends on an individual's or family's financial circumstances and health status. Those who have recently arrived in the country might consider asking a social worker or a friend familiar with American healthcare how to best access programs like state insurance or local hospitals' free care programs. These programs are limited, have complex registration process, and often require many phone calls and appointments to complete. However, without health insurance, healthcare is unaffordable for most people living in America. Those with state insurance or hospital-sponsored free care may lose their coverage if they become employed or their income changes. It can be confusing, but there are organizations that offer support to help patients understand. Health insurance helps cover the cost of checkups, visits when sick, and reproductive health care, including prenatal appointments with healthcare providers, ultrasounds, blood and urine tests, and giving birth in the hospital. Health insurance helps pay for assessment and treatment of illness or injury, yearly checkups called physical or well-child visits, immunizations, and with the proper referral from one's healthcare provider, other treatments such as physical therapy, mental health services, and sometimes even non-Western type treatments such as acupuncture. With a written prescription from an individual's healthcare provider, insurance usually pays for part or all the bills for medicines, including prenatal vitamin supplements, professional breastfeeding support from lactation consultants, and medical equipment rentals like wheelchair and crutches, and for people giving birth who plan to be separated from their baby for work or other reasons. Electric breast pump so that infant can drink human milk when the breastfeeding parent is not there to feed the baby.